Hello, everybody. Thank you all for being with us. So excited. I'm Lisa Adler. I'm co-artistic producing director at Horizon Theater Company and director of the play Row. And we are gathered here today for a community conversation with some incredible leaders in our community. We are doing this play Row that runs through June 12th with a possible extension to June 19th. And it is the story of Roe versus Wade told through the eyes of two of the women that made it possible: Norma McCorvey, Jane Roe, and Sarah Weddington, the lawyer who argued the case at the Supreme Court. So we are taking this opportunity to connect with people in our community that are boots on the ground dealing with these issues here in Georgia. And we are thrilled to have this panel with us. And I'm going to ask, let's see, Tamara, if you could turn your video off, that would be great. Everyone that is viewing us that is not a panelist, if you could just stop your video, and then we will be able to not have you on the screen. There you go. Thank you so much. All right, and I'm going to introduce Megan Dominy. Megan is an actor, director, producer, playwright who was in DC doing the 40 productions over the last 13 years and is now here in Atlanta. And she is also an incredible activist and has been working with us on community engagement for the play. And she is going to be our moderator tonight. So it's all on you, Megan. Take it away.
Thank you, Lisa, and thank you, like she said, to everyone for joining us. The story of Roe is a very interesting one, and it's a wonderful play if you haven't seen it yet. But unfortunately, as we all know now, Roe is certainly not the final word on abortion access. And we are all sort of waiting to see how the landscape of choice evolves and if and when it is struck down. So I want to thank our panelists so much who have joined us tonight, because I'm sure that their work has made them incredibly busy. And we are appreciative that they're here to share their expertise and their knowledge so that we can all benefit from it. So without further ado, I will introduce our panel. For everyone watching at home, if you have a question specific for the panel, go ahead, type it into the chat, and we will get to as many of the questions as we can as time allows. We do already have some pre-submitted ones. So joining us this evening, we are so fortunate to have Kwajelyn Jackson, who is the executive director at the Feminist Women's Health Center in Atlanta. We have Jamie Manson, who's the president of Catholics for Choice. And we also have Rochat, a research professor at the Hubert Department of Global Health at Emory University Rollins School of Public Health. And those are all very, very short monikers and titles. You have to read their bios to fully appreciate all of the expertise and experience they are bringing to this panel. So I'd love to go ahead and start out with the panelists just telling us a little about yourselves, your work, and your background, and also, what do you think is the most important thing you would like us to know about the current landscape of choices for someone facing an unintended pregnancy today? Let's start with Kwajelyn.
Hello, everyone. I am Kwajelyn Jackson. I have served as the executive director of Feminist Women's Health Center since 2018, but we have been providing compassionate abortion services in Georgia since 1976. We currently provide both medication and procedural care up to the legal gestational limit in Georgia. We also do comprehensive gynecological services and trans health care, so STD testing, contraceptive care, and some limited preventative services. In addition to our clinical care, we also do legislative advocacy, civic engagement, community education, leadership development, and movement building work in the community. As well as having a registered lobbyist who helps to protect reproductive health rights and justice at the Capitol during the legislative session. So we are deeply mired in all aspects of this movement, reproductive health, rights, and justice, and are committed to continuing to offer abortion services in whatever ways the legal landscape allows for as long as is possible. I think the thing that I want people to know before we get more deeply into the conversation is that Abortion is still legal right now, and if there are people in your life who are in need of care, there are many resources available to them to help them get the care they need immediately. I know that in this moment, particularly after the leak, there is a lot of uncertainty and a lot of fear, and so we want people to continue to seek out the services that they need and not delay because of fear or uncertainty. And then I'd also just mention that in addition to Planned Parenthood and some of the larger national institutions that people are familiar with, there are independent providers like Feminist Center all around the country that are also providing necessary abortion services and abortion funds that are helping people logistically and financially to seek care. So looking forward to the rest of the conversation.
All right, and Jamie, do you want to go next?
Sure. I got so involved in what Kwajelyn had to say, I forgot the question. Could you remind me? I apologize.
Yeah, of course. Just tell us about your work, your background, and then, the most important thing you want us to know about this conversation.
Absolutely. Yeah. So I am Jamie Manson. I'm president of Catholics for Choice. Catholics for Choice has been around for almost 50 years now. Started right after the Roe ruling. And basically what we do several things. We encounter, we educate, and we embolden people of faith who believe in reproductive freedom. And those people are the majority of people, believe it or not. The white nationalist Christian supremacist movement has claimed this anti-choice movement as a religious one. And it's simply not the case. The majority of people of faith do support abortion rights, do not want to see Roe struck down. And in fact, some religious traditions like Judaism and Islam support abortion. And so we have a big religious freedom issue here. In terms of my own background, I'm a theologian. I was called to be a Catholic priest when I was 14. The Catholic Church does not ordain women, but nevertheless, I persisted. And so I think that was sort of my entree into seeing the profound injustice of the way in which the church treats women. And misogyny is really at the root of the church's teachings on abortion rights and contraception. And, it's the anti-gay stance and all of those anti-trans stances. So that sort of, I went all the way through divinity school. I have all the degrees I need to be a priest. But I don't know. I think God wants me to do this and fight from the inside in this liminal space in the church. And so that is what I do. So my specialization was sexual ethics and Catholic theology, which made me perfectly suited for this very niche position that I have right now. So that is what we do. And I think for me, for our work, the most important thing is about this moment, and I really spoke to it a few minutes ago, is just knowing that if Roe is struck down, this is not a victory for faith. This is not a victory for God. There is nothing holy about this. This is again, a victory for a white nationalist Christian supremacist movement that, veils itself in Christianity.
Excellent. Oh, thank you. And then Roger, tell us about yourself, please.
I love what you just said, Jamie and Kwajelyn. Thank you. I stumbled into this area early in my career. In 1968, I actually joined CDC, the Epidemic Intelligence Service, was sent to the state of Oregon and spent 2 months in East Pakistan treating cholera patients, and became impressed by population issues and changed my job and my career from infectious disease to family planning evaluation. Was reassigned to the state health department in Georgia, given 2 assignments, one of which was to evaluate Georgia's new abortion law. In April of 1968, Georgia decriminalized abortion with a very restrictive law requiring abortions to take place in hospital, have 3 physicians approve them, and only available for Georgia residents. I then examined the deaths of women, maternal deaths that were recorded between 1950 and 1969. 70% of those deaths were to African-American women. Population proportion that was African-American was about 10%, so a substantially greater risk. About 75% were to married women. For white women, it was 99% married women, and for African-Americans, about 75%. After the law was passed, abortion mortality disappeared for white women and partially for married Black women, but not at all for single Black women. I presented that paper at the American Public Health Association and received a phone call from a lawyer saying, "May I use your paper? I am suing the state of Georgia." And that is when I met Margie Pitts-Hames, we took the Dovey Bolton case to the Supreme Court, and it was overthrew the Georgia law along with the Texas law on the same day. It doesn't get well recognized. When Sarah Weddington came to CDC to celebrate an anniversary of Roe v. Wade, immediately afterwards, I came down to Georgia State and we celebrated Dovey Bolton. So there's different perspectives in different parts of the city as to which one we celebrate. In 1972, the year before Roe v. Wade, I spent a summer working in an abortion facility in Washington, D.C. that was doing about 20,000 abortions a year. About the same time, about half the abortions conducted in New York City were from out of state residents. People came from Chicago by the busload. It's hard, and CDC became involved investigating abortion complications and abortion deaths and issued 13 epidemic investigations during that time period. One of them I remember well, a young woman from Arkansas who had gone to New York City for an abortion because she did not want to tell her parents what she was doing. And when she returned home, no one knew why she had a fever, and she did not tell, and she was hospitalized and died. I will tell you that 20 years later, I was working in the Georgia Health Department again in 1994 and learned of the death of a young African-American woman who had gone to an abortion providing facility and, deterred by protesters, went back to her residence and inserted a coat hanger. She too died as a result. I do not know whether deaths still occur. I lack confidence that we have a complete reporting system, but I do believe they're extremely rare. And I think they're rare because of the accessibility of safe abortions, improved access to contraception services, and in some places, markedly improved sex education. So those three interventions are absolutely essential. But if Roe v. Wade were to be stricken down, I have complete confidence in women and those who care for them that most of them would get safe abortions and safe procedures. Abortion is universal. It always has been. I've studied it in numerous countries in Asia and Africa and Eastern Europe. You cannot suppress it. It will not go away. It will be there. It's only how it's managed and how much we care with respect and with dignity for women and their lives. Thank you.
Thank you all so much. It is a stunning panel, and we are so honored to have all of your talents here. So first question that anyone can go for and answer if they feel called. Over the years of your working in this space, what have you learned that you think might surprise us?
I'm surprised abortions haven't decreased a lot more than they have, but I think it's the lack of adequate sex education and contraception throughout the state.
I think something that surprises me every day is that 1 in 4 abortion patients in this country identifies as Catholic. And so we have a church that calls this murder from the moment of conception. If you destroy an embryo from the moment of conception, it should be considered murder. There's no inroads for dialogue about this issue. The punishments for talking about it in a Catholic space from parishes to universities is swift and severe. And yet it is part of the life of the church, and people who are participating in the life of the church are having abortions, and you just have this heavy, heavy taboo around the issue. And I feel like that's a pastoral crisis, and it's shocking. And I think that Catholics have not reckoned with that, how much abortion is woven into the fabric of the church.
I don't know. It's hard to think about what surprises me, but I think that before I started doing this work, I had a little bit of a limited understanding about the reasons why people have abortions. And I think what I want people to know is that there are countless reasons, that not every abortion story is tragic, that some abortion stories are a relief, some abortion stories are very sacred and special, some abortion stories are very matter of fact, and some are deeply complicated, and that there's no one way to capture all of the different things that bring someone to decide to terminate that particular pregnancy at that particular moment. And it's really important for us to keep that in mind, that there's no broad brush for people who have abortions.
Excellent. And can anyone speak to issues surrounding the intersectionality of race and gender and how that affects reproductive care access?
Well, certainly Roger alluded to some of that in his remarks, and so I hope that he'll continue to talk more about what he saw. So at Feminist Women's Health Center, the majority of the patients we see are Black, but also the majority of our staff and leadership are Black. And I think that that is really important for the ways that we are serving our community. Oftentimes, anti-abortion extremists talk about abortion in the Black community and try to demonize it and try to sometimes co-opt the language around racial justice in order to undermine trusting Black people and Black women with their own reproductive health decisions. And so the things that I think often about, again, compounded with what I said earlier about there's a million reasons why people are choosing abortion. I also think that the significant oppression that exists in Black communities reflects in the reasons, some of the reasons that people might choose to terminate pregnancy. I don't think that it is a choice if people are living in such difficult and complicated circumstances that they don't feel like they have the option to grow the families that they want. And so we want to make sure that abortion remains an option for people when they need it, and we should be investing in people's ability to thrive in all the circumstances that they find themselves in. And so when people are choosing between continuing a pregnancy and bringing a child into a world where they'll be faced with police violence or not have stable housing or not have access to quality education, where they believe that they will be mistreated when they enter the healthcare system to even deliver that child, that's not actually a choice. So I think as we are working diligently to protect the right to abortion, we should also be thinking about the ways that we can improve the conditions that people find themselves in. I also sit on the board of directors for the Black Mamas Matter Alliance that has been working for many years on maternal health and addressing the huge disparities that exist in maternal mortality. And while we don't want to think about abortion as an answer to maternal mortality, both of those things should be looked at in parallel lines. What are the ways that we're investing in the well-being of communities of color for the long run?
Yeah, I want to echo what Kwajelyn is saying about reproductive justice framework, that, choice is a luxury. It's very often the luxury of white or wealthy people, and what is choice for people who don't have choices? And so we have in the Catholic tradition, we have this very rich social justice framework. And so we see a lot of overlap between that framework and the reproductive justice framework. We have a lot of mutual strengths. And so it's hard to talk to Catholics about abortion, but talk to them about maternal mortality, you'll get their attention, or talk to them about care for the environment or workers' rights, all of those issues that come to the fore whenever someone gets pregnant is so important. The other thing I would say about this intersectionality is the history, really, of the modern anti-abortion movement is rooted in white supremacy. It was a very deliberate, well-documented pivot from segregation, which evangelicals were animating their base based on, segregation. They wanted to run segregated Christian academies. And finally, in the mid-70s, when that just became untenable, because even, white people in the South were getting uncomfortable with that being their animating issue, they pivoted to abortion. And they got the idea from Catholics who were having a lot of luck using abortion to animate voters at the polls. And they said, oh, finally, we have this respectable issue that we can pivot to. And that's what we have today. So Catholics, this is all Catholic ideology that we're seeing being codified into law right now. The idea of personhood and life beginning at conception and being anti-IVF. These are all very fringe Catholic ideas. But it was evangelicals who really put the movement on steroids and got themselves a seat at the Republican table. And that's what we have today. So I think it's so important to say the whole modern anti-choice movement is rooted in profound misogyny and profound racism. Those are really the roots that this grows out of.
Would you say that that's white evangelicals only or evangelicals all?
Yeah, I would say, no, white evangelicals. That's a really good point, Roger. Thank you. Yeah. I'm not talking about Black church folks, but white evangelicals. That was the Southern strategy, right? That was how they got Southern Democrats voting, was, initially on segregation and then pivot to abortion. So thank you, Roger. Great clarification.
Yeah, Roger, anything you want to add to that?
Yeah, the thought of I have a limited perspective on abortion, I must say, but my work in Bangladesh and 2 national studies there, and this data from pre-Roe in Georgia, of it being predominantly married women, all speaks to me of being women in desperate circumstances, driven, whether it's by poverty or whatever the other circumstances are. And I know it's not just poor women who get abortions, but it's poor women who are more likely to die from getting abortions. And I think that's important. And I think that would be a potential consequence of overthrowing Roe. We did a study in the late 1970s when the federal government and many states stopped providing Medicaid funding, federal Medicaid funds for abortion. And we set up surveillance systems around the country to see if we could find any deaths as a result. We ended up doing an in-depth investigation in Texas, near McAllen. We did an investigation in South Florida. We didn't find much. It did not have an overwhelming, in-your-face series of hospitalizations of individuals with unsafe abortions. That gives me hope that, again, we would not find a serious public health problem resulting from overthrowing Roe. And I certainly think there's been a lot of adaptation since that time in the improvement of services, including reproductive health and abortion services. I'm chagrined we have to find ourselves in this situation. I have to admit, it's just, yeah. I'm embarrassed as a one-time evangelical Christian to find myself speaking against family, against people I dearly love and respect because of this issue. It's been hurtful, but there's no question where I stand on the issue.
I'll just offer one more thing to the gender part of the question. You know, one of the things that we've also been working really hard on is to expand the conversation to include trans and gender nonconforming folks, understanding that, you know, not all the people who need abortions identify as women, and not all people who identify as women can get pregnant. Just really trying to complicate this idea that this is just an issue that affects cis women. And I think, you know, thinking again of the tenets of reproductive justice and our desire for people to have access to bodily autonomy, we want to continue to make sure that the fights that we are having around protecting abortion access are also expanded to think about gender affirmation and the ways that those communities are also being simultaneously attacked by often the very same actors. And so there is so much more opportunity for us to link arms in those fights in order to, again, protect reproductive justice for all people.
Thank you. Thanks, Kwajelyn, for circling back to that aspect as well. So next question, I feel like Roger will be the first to answer, but let anybody go for it. Unintended pregnancy has always been part of human history. What are common attitudes, methods, and practices for women and communities throughout history to deal with them?
Infanticide, abortion, abandonment, and it depends a lot on the cultural situation, and I would say and not just for unintended, but even for intended pregnancies, this is true. When I was working in Hanoi at the major medical school in Vietnam, they do not count a birth weighing less than 1,000 grams as being live born because they don't have the capacity to resuscitate it. It's a resource issue that defines whether it's live born or not. In some other culture, it may be they don't give a name for a week or for a year until they are certain that the infant will survive. In Eastern Europe, where abortion has been legal off and on since the early 1920s, unintended pregnancy, whether mistimed or unwanted, is usually terminated. In our country, unwanted pregnancies, that is, never wanted to get pregnant, are likely to be terminated 90%, but mistimed, only about half are terminated. Is that just an access issue or is it a cultural difference? I don't know. But abortion has always been there, and Jamie can confirm, I don't believe that it's condemned anywhere in the Bible or Quran, in any of the holy scriptures.
That is correct, Roger. Yeah, it is not in the Bible. That there's many mentions of conscience in the Bible and things like that. What I would say, taking a very different tack from Roger, is that religious leaders were very involved in getting what we would then say women to safe abortion before Roe. There was the clergy consultation service, and this was even priests, nuns, all manner of mainline Protestant ministers, Black pastors, rabbis, assisting in making sure women got access to safe abortion. It was sort of, a quiet, discreet channel of people, network of people that would do this. And they did it out of compassion, out of mercy, out of honoring human dignity, out of social, as a matter of social justice that was formed by their faith, by their reading of the scriptures. And we're actually thinking of rebooting it now. In light of what's happening in some new form, because we need to step into the breach.
My next door neighbor in Atlanta was Emmett Herndon, who was one of the compassionate clergy. He worked at Emory University and occasionally took a pregnant girl into his home until he found a place for her to get an abortion.
Yeah.
The only other thing I'll add is just there's there are historians who talk about the ways that during chattel slavery in the United States, enslaved women also took control over their reproduction, oftentimes for their safety and to try to curb the ways that they were being forcibly bred during that period. And so I highly recommend folks read Killing the Black Body by Dr. Dorothy Roberts, which talks pretty expansively about the ways that reproductive oppression and obstetric violence and forced sterilization and all the sort of many iterations of oppression have affected communities of color.
Thank you for that, because actually the next question is also about book recommendations. So that one might be for the grown-ups. I'm not sure. Okay, it sounded like it. Someone pre-submitted a question asking if people could recommend a good book for either high school and or junior high age students on how to talk with them about the issue of abortion.
So I have two offerings. One is actually for a little bit younger. There is a board book called What is an Abortion that is a really nice illustrated story. It might skew a little bit younger, but it's very medically accurate and appropriate. The other that I would recommend is there's a book called Comics for Choice that is a compilation of comic strips, graphic stories that are all put together from multiple perspectives, talking about people's abortion stories that I think are also really, really beautifully done and might be in a format that young people would really appreciate. And I'll throw one more in. There's a great picture book called Shout Your Abortion that has individual abortion stories. I mean, I can't say definitively that it is not super adult, but for the most part, they are just very matter of fact abortion stories that people were going through in the moment. And it also has really beautiful portraits that are accompanying each of those stories.
Yeah, and Shout Your Abortion, I think, is Amelia Bonnow, and who leads that organization. And she actually wrote, I think, the foreword to a book, or the afterword actually, to a book called My Mom Had an Abortion, written by a teenager and illustrated by a well-known cartoonist. And so that would be my offering to that, is My Mom Had an Abortion, available on Amazon or wherever you get your books. Just came out in December.
Any recommendations, Roger?
I don't have. I like the ones that have been recommended.
They sound great, don't they? I'm glad they're available on Amazon. So this was also a pre-submitted question. Which social services will monetarily help the mothers after a child is born? And will social services that aid mothers and children get a budget increase to address the expected increase of births? So what do we think, looking in our crystal ball?
So I mean, I don't know the answer definitively, but I'll just say that my experience has taught me that there is not sort of an equal investment in the well-being and health of children and families that equates to the energy, resources, and time that is being spent in the anti-abortion fight. So we can see, again, there's a really wonderful study that IBIS Reproductive Health and the Center for Reproductive Rights did called Evaluating Priorities, that measured the states that had the highest number of abortion restrictions on the books against the number of policies that were in place that support I think it was like over like 12 or 13 measures of child and family and maternal welfare. And in many of the places where the most abortion restrictions existed, they also had the highest instances of maternal mortality, infant mortality, low birth weight babies, impoverished families on financial assistance. Like, you know, you can take a state like Mississippi, for example, where you can have seen generations of disinvestment from deeply impoverished majority Black communities, where they are also facing some of the harshest abortion restrictions in the country. And so the idea that people would then, you know, turn their attention to supporting birth and pregnancy, I would be very surprised if these same actors were interested in that. But what we know is that providers around the country have been preparing for this for a very long time, Feminist Women's Health Center included. You know, abortion is not the only service that we provide. So we are, you know, of course, helping people get access to contraceptive care and emergency contraception if they need it. We're exploring the ways that we can support birth, fertility, pregnancy, postpartum, for the people who want and intend to continue a pregnancy. We know that for many people who are seeking abortion care, they are already parenting. And so they're in need of support for diapers and, in this moment, formula or assistance with breastfeeding. And so reproductive justice organizations that are thinking about this work holistically are deeply interested in supporting people's whole lives and not making abortion the only thing that we are concerned with, but really trying to help people, again, self-determine and have all of the resources that they need in order to make the choices that are best for them. So that's my answer. I think that our systems are going to be significantly strained if the road is completely overturned, as was indicated by the leaked opinion. We're already in a situation where people have to travel for care. At Feminist Women's Health Center, we're seeing patients from Mississippi, Alabama, Tennessee, South Carolina on a regular basis now, when Roe is completely intact, because of all the obstacles that people already face to try to get the care that they need. And so if the trajectory that we're on is seen through to fruition, and so many states either go to a complete ban on abortion with no exceptions, or such significant restrictions that there's not enough time to meet the demand, the states that do offer care are going to be completely overwhelmed. The abortion funds that are working to get people travel and funding and practical support are also going to be completely overwhelmed in trying to help thousands of people navigate extreme obstacles. And then you add criminalization of both providers and individuals on top of that, it's a really untenable situation. And so we're doing everything that we can to try to shore up the ecosystems as they exist and try to continue to fight this in every way possible, because we know that this can't last.
Anyone else want to hazard a guess on what programs could be improved, what programs we could be investing in that would be helpful to people who have children who choose to carry out a pregnancy?
Well, to that part of the question, I'll also just offer, I'll just keep going, that, you know, investing in abortion funds is really critical, but also there are community birth workers around the country that are also woefully underinvested in. So midwives, associations, doula programs, lactation consultants, folks who are working both in conjunction with traditional healthcare and independent from, supporting communities that, again, may live hundreds of miles from a maternity ward, who might not have access to consistent preventative care for other conditions that they're facing, who might need to have that kind of support. So a lot of the birth justice community and the reproductive justice community are working in lockstep with one another so that we can make sure that, again, communities have the things that they need. I don't hinge my liberation on what the existing systems will provide us. I believe in building the systems that we need on the ground. I have not seen sufficient evidence that government is interested in, again, in the well-being of the communities that I care about, and therefore it is our duty to work around them and to try to create the synergies that our communities deserve, so that people can, again, can live healthy, thriving lives in the ways that they want, can be treated with dignity and honor, can have access to a future.
Great, thank you. Do any of you think it's possible that the Supreme Court will make changes before a final version of this comes out, from obviously the one that was leaked?
Yeah, it's definitely possible. I mean, it was a draft. And that's part of the normal process to write drafts, as part of the deliberative process among the justices. I think, you know, it's going to depend. We weren't surprised, like probably the experts on the school weren't surprised by that draft, because we listened on December 1st to the arguments that were being made. And we know five of the justices are radically anti-choice Catholics. We know that at Catholics for Choice. It's very important to remember 6 of 9 justices are Catholic. Only one of them represents the thinking of Catholics in this country. The other 5 are, you know, very, very hard right. And so definitely, I think my worry is that they'll gut it, but it won't be an absolute overturn. And so they'll create confusion among people. And so they'll still be able to campaign on the issue, but it will effectively be struck down.
I completely agree. I think, you know, I'm not a legal scholar, I'm not an attorney, but I do think that Chief Justice Roberts is concerned about the integrity of the court, and but is also anti-abortion, just to be clear. And so I think that is the negotiation that might be at play. And if it falls just short of overturning Roe completely, but upholds a 15-week ban in Mississippi, it definitely creates a ball of confusion that could really damage our ability to organize, but also might provide more legal runway for reproductive rights attorneys to continue to fight on our behalf. And so I think what is really clear is that Roe has been woefully insufficient for a very long time, that the privacy-based argument was not enough. And so we actually need stronger rights-based protections. We need, you know, to be able to codify the right to abortion in a more strong way. But the other part of that is just that taking away sort of the privacy basis also upsets other rights that we hold dear. And so I think that is the intention that was, again, made clear both in the oral arguments and in the decision, that this is pulling a thread to upend many of the rights that are important to us. And, you know, as Jamie shared earlier, uphold white supremacy and uphold the people who are in positions of power and are doing everything they can to maintain it in the face of a changing nation.
Roger, what do you think? Do you think there will be any big changes or edits before we see a real push from the Supreme Court?
It would be total speculation on my part, but I do think Roe v. Wade is going to be overthrown. I think that's been in the cards for some time. And I like Kwajelyn's assessment. It's good.
It is.
It's
All right, well, we're nearing the end of our time. And I want to bring everyone's attention to the chat just to let people know that Kwajelyn and Jamie actually shared the links to the books they recommended. So if you're interested in those, they've made it very easy to be able to locate them. And coming off of this feeling that I feel everyone thinks, yes, Roe is probably headed to be either gutted or overturned. One of our submitted questions was, I feel helpless. Besides voting, what else can I do? And this is a really important question so that everyone can leave here with an idea of how they can help be part of a solution or get active. So what can we do?
stand up and speak out in every environment you find yourself, to as much as you're capable of doing it. It's
Yeah, I would completely agree. I think that having like candid, frank, honest conversations in your community about abortion, about sex, about pregnancy, about miscarriage, like the more we can destigmatize these kinds of conversations, I think that also humanizes the issue and makes it less about my team votes this way, your team votes this way. What I've also been reminding people is like local independent clinics, local abortion funds, and local elections are really what we want people to focus their energy and attention on. Again, a clinic like Feminist Center, if you're not a person who is in need of abortion services, but you might need a pap smear, we also do those. And so being able to provide other comprehensive care also helps us to keep our doors open when abortion is so significantly restricted. So again, while people continue to think about the big national brand recognition organizations like Planned Parenthood, like ACLU, never going to tell people not to support and invest in those, but just to remember that independent providers are also out here chugging along with a lot less visibility than some of those. Abortion funds, if you can give, money is the best way to support their ability to get people be able to travel, gas in their car, child care for the kids they already have, food in their stomachs. Like literally, abortion funds are the ecosystem that helps to move people throughout this already very complicated abortion landscape. And there are, in Georgia, we're served by Access Reproductive Care Southeast, or ARC Southeast. They serve 6 states. So in addition to Georgia, Florida, South Carolina, Tennessee, Alabama, and Mississippi. And if you can't give money, you can give rides to patients. You can be a place where patients can stay. There are ways that you can volunteer your time if you're comfortable to help to support like the active work of getting people to and from their abortion appointments safely. And then the very last thing I'll say, I know that people are frustrated with the voting conversation, but at the local level, there is significant impact that can be made. So in a state like Georgia, the election this November that will determine our governor, our lieutenant governor, our secretary of state, like there's a very direct line for what's possible in a state like Georgia based on the local and state level elections. We can see the ways that the states have been so instrumental at some of the harshest and most devastating legislation that has come out. And the Supreme Court is basically saying, let the states do what they want. And so if we pay all of our attention to the federal level politics, we will miss the things that are happening right in our own backyard, where we have much more influence and where we have much more access. So places like Feminist Center can help get you trained up to go and lobby at the Capitol, on how to engage with your local senator and representative, on how to get engaged at the city level and what can happen at the county level. There's plenty of things that can happen beyond the election to hold people accountable to the issues that we care about.
I'll only, Kwajelyn is speaking so brilliantly, I'll only add one more small piece. I think we have to be, this is a time for real civil disobedience. You know, we Catholics for Choice has sister organizations throughout Latin America, and I'm looking to them for their vision, for their, their witness to what they were able to do in their countries. And I think one of them is we're not accountable to this law. You know, I think we have to reject the law and say, no, we're doing it anyway, in some way, you know. And if it's, I have visions of, 100 people surrounding someone who's trying to get abortion care, and just, saying, arrest all of us. Do you know what I mean? I think it has to be time for some very creative civil disobedience actions around this. We should not accept this. We should not accept this. This is profoundly unjust. It is a movement pushed by awful people who want white male dominance to reign in this country. And I think we have to reject it fundamentally. I want us to all step into the breach. I think it's very important, but it's also radically unjust. We should not tolerate this.
Thank you all so much. Thank you everyone who joined as an audience member, participant. Thank you, of course, to our panelists who brought so much weight and experience. And thank you to all of our panelists who have done this vital work for years and years and years. And it's not easy work. Thank you for helping teach us how we can stand with you in it. And I know that I learned a lot from this panel. Lisa, is there anything you wanted to add before we let everybody go?
I just want to say that Amplify Georgia approached me at the show, and they are currently trying to get people to sign a petition to tell Atlanta City Council to fund abortions. They're trying to get money for women to go to other states if they need to, if something were to happen, and for others to come here. And it's Amplify Georgia Collaborative is their website. I have a QR code that I can't really show that on the screen here, but you can go there. And they said, do it this week because the budget is next week. Thank you so much. What an informative panel, and so much great information for us to know about, and for me to share with our audiences who will be so interested in this, and finding out what they can do and what will happen. This is our community conversation around our production of Roe, which is running for another few weeks. We encourage you to come see the show, and I hope our panel will come as well. And thank you for your incredible expertise.